Hey, Dr. Steinbacher here, and today I want to talk to you about questions that were asked quite frequently related to the chin and chin aesthetics. And this has to do with considerations of an osseous genioplasty versus the various types of chin implants that are available. And there's pros and cons of both. We're frequently proponents of osseous genioplasty, and this entails cutting of your own bone, moving it in space, and using a metal plate or a titanium plate to hold it in space. Advantages of this are that it's your own tissue, so it'll heal in place, and there's great three-dimensional control of that bone segment. So it can be moved, it can pull muscle attachments along with it. The only implant associated with this is a titanium plate, and once it heals, that can be removed later. I would say one of the downsides of it occasionally is that there is a step off, or there's a ledge of the bone that sometimes you can feel or palpate, but frequently we'll bone graft that area and there'll be no irregularities. In distinction or contradistinction, we could talk about some various implants. The most common probably is a silicone type implant. There's also MedPore or Supor or porous polyethylene type of plastic implant. There are metal implants, and there's another type of plastic called PEEK. So a difference here is that for osseous genioplasty, this is typically done up under the lower lip inside the mouth, so no incisions on the outside of the face. For these other types of implants, it's usually placed under the chin in the skin here, and that incision does hide pretty well, and it can be a little bit smaller if it's a silicone implant because the silicone is moldable and you can kind of compress it when you're placing this. Frequently this is held with a screw or two, or sometimes sutures. The downside of silicone is when you apply it to the bone, it causes a bit of resorption. So it creates a capsule around it, just like a breast implant or other type of silicone implants, where there's a capsule of fibrous tissue, and that on the bone surface can lead to some erosion of the bone, or kind of a carved out area where the bone actually dissolves or erodes. And the capsule on top of the soft tissue can also have a slight abnormal appearance as well. And additionally, it's not pulling your own bone and muscle attachments forward, which can pull the tongue and improve breathing a little bit too. But there are occasions that we will want to use those, and patients will prefer silicone implants. The other types of off-the-shelf or alloplastic implants, and these can be custom, by the way. There's a MedPore, Supor, porous polyethylene that can come in different stock sizes. This is a little more rigid, and here's an example of one, and sometimes you can have these in two different pieces that can come together, so it enables ease of placement with smaller incisions. I like this a bit more than silicone typically because it doesn't cause that capsule formation, it doesn't cause erosion of bone, and there's pores in it that enables your macrophages and white blood cells to be able to grow in, tissue ingrowth, and fights infection a little bit more. So there's less of a capsule. Some say that they're more difficult to remove, but in my experience, if you know where they are and where they're placed, and have it fully dissected, they're not difficult to remove. PEEK implants are a little more rigid. It's kind of a firm plastic that's applied and has less tissue ingrowth, and metal, titanium typically is also firm, less tissue ingrowth, and feels a bit less natural. These are some of the pros and cons, and not every situation or patient has one right answer in terms of what we do, but consider an osseous genioplasty versus some of these implants. You know, most of the time we want to use osseous genioplasties, which has better three-dimensional control. It's moving your own bone. There is a titanium plate that can hold things in position. Most of the time we're doing this with a custom cutting guide and titanium plate that really, with high fidelity, repositions this chin. But there's many options at our disposal, so feel free to discuss this with your surgeon and discuss the pros and cons. But that's, in a nutshell, you know, some of the pros and cons of these different genioplasty options. Thanks very much. If you like this video, please check out our channel for additional content related to jaw surgery, plastic surgery, maxillofacial, and rhinoplasty. Please follow us or like any content as well, and check out in our bio additional links, links to our website and other social media platforms where you can find this and additional content. Thank you.